Guys, it's me Bhavna. I'm a final prof student and I'll be teaching Leukorrhea. So what is Leukorrhea? So before reading Leukorrhea, we should know the characteristics of normal vaginal fluid. It is watery, white in color, non-address with pH around 4.0. Microscopically, it contains squamous epithelial cells and a few bacteria. Lactobacilli, few gram-negative bacteria, and anaerobes are present without any white or red blood cells. So now, what is Leukorrhea? Leukorrhea is excessive normal vaginal discharge. The term Leukorrhea should fulfill the following criteria. The excess secretion is evident from persistent vulvar moistness or staining of the undergarments or need to wear a vulval pad. It is non-purulent and non-offensive. And third, it is non-irritant and never causes pruritus. So these are the three criteria which should be fulfilled for the to be called as Leukorrhea. So when does Leukorrhea occurs physiologically? The normal secretion is expected to increase in conditions when the estrogen level becomes high. Like in physiological excess occurs in four conditions: during puberty, during menstrual cycle, during pregnancy, and during sexual excitement. So during puberty, increased level of endogenous estrogen leads to marked overgrowth of endocervical epithelium, which may encroach onto the ectocervix, produces congenital ectopy, and that leads to increased secretion. During menstrual cycle, around ovulation and premenstrual pelvic congestion and increased mucus secretion from the hypertrophied endometrial glands occurs. And during pregnancy, there is hyperestrogenism with increased vascularity. This leads to increased vaginal transudate and cervical gland secretion. During sexual excitement, when there is abundant secretion from the Bartholin's gland. Now pathologically, it occurs due to cervical cause and due to vaginal cause. So in cervical cause, it is due to cervical ectopy, chronic cervicitis, mucus polyp, and ectropion. What are the vaginal causes? The conditions in which Leukorrhea occurs are uterine prolapse, acquired retroverted uterus, chronic pelvic inflammation, pill use, and vaginal adenosis. So now, how we will diagnose a case of Leukorrhea? First of all, we will take the history. In history, should cover the symptoms, the duration of discharge, any prior episodes, any associated dysuria, dyspareunia, pelvic pain, and use of contraception should be asked in history. Then we do physical examination to cover the general health assessment, abdominal examination for any mass or tenderness, inspection of vulva for the discharge any ulcer. Then we do third thing, we do speculum examination to detect any pathology in the cervix and vagina. Fourth, we do bimanual pelvic examination for any foreign body, adnexal tenderness or mass. Investigations to be organized for the discharge are microbiological study, pap smear, urine for routine examination, culture insensitivity test for PCR, NAT for the pathogens. The following are the guidelines that we do for the treatment of Leukorrhea. First of all, we will focus on the improvement of general health of the patient. Then cervical factors require surgical treatment like electrocautery, cryosurgery, tracheography. Pelvic lesions producing vaginal Leukorrhea require appropriate therapy for the pathology. Pill users may have to stop pill temporarily if the symptom is very much annoying. Above all, the local hygiene has to be maintained meticulously and the treatment for specific infection has to be done. That's all. Thank you.